Welcome to another lesson by BeWell. Shaping the health and care workforce of tomorrow. The BeWell project addresses the need to prepare the health and care workforce for green and digital solutions introduced in the European health and care systems to ensure they can respond to current and future challenges. In this lesson, we will describe in detail the various types of telehealth, which will help us delve into the specific aspects of each one later on. Trying to give a definition of telehealth, we say that telehealth refers to a mode of delivering healthcare services through the use of innovative technologies, particularly information and communication technologies, in situations where the healthcare professional and the patient, or two professionals, are not in the same location. Telehealth involves the secure transmission of medical information and data in the form of texts, sounds, images, or other necessary forms for the prevention, diagnosis, treatment, and follow-up of patients. Telehealth services are to be considered as any diagnostic, therapeutic healthcare service. However, telehealth does not replace traditional healthcare in the personal doctor-patient relationship but complements it to potentially improve effectiveness, efficiency, and appropriateness. Telehealth must also comply with all the rights and obligations inherent in any healthcare act. It should be noted that the use of information and communication technology tools for the treatment of healthcare information or the online sharing of healthcare data and/or information does not constitute telehealth services in itself. Examples of services that do not fall under telehealth include healthcare information portals, social networks, forums, newsgroups, email, or others. The category of specialist telehealth includes various modalities for providing remote medical services within a specific medical discipline. It can occur between a doctor and a patient or between doctors and other healthcare professionals. Depending on the type of relationship between the actors involved, specialist telehealth services can be carried out in the following ways. The first one is televisit. It is a medical act in which the professional interacts with the patient at a distance in real time, also with the support of a caregiver. Televisit, as also provided for by the Code of Medical Ethics, can never be considered the sole means of conducting the doctor-patient relationship, nor can it be automatically considered a substitute for the first in-person medical visit. The doctor is responsible for deciding in which situations and to what extent televisit can be used in favor of the patient, also using telehealth tools for remote detection or monitoring of biological parameters and clinical surveillance. Televisit is limited to the follow-up activities of patients whose diagnosis has already been established during an in-person visit. Teleconsultation, instead, is a medical act in which the professional interacts remotely with one or more doctors to discuss the clinical situation of a patient, also through a video call, primarily based on the sharing of all clinical data, reports, images, and audio-video materials related to the specific case. All the mentioned elements are shared electronically in the form of digital files suitable for the work that the doctors in teleconsultation consider necessary for the proper execution of their tasks. Teleconsultation among professionals can also take place asynchronously when the patient's situation allows it safely. When the patient is present during the teleconsultation, it occurs in real time using similar operational methods as in a televisit and is configured as a multidisciplinary visit. A more specific kind of teleconsultation is medical health teleconsultation between hospital doctor and general practitioner. Medical health teleconsultation is the assistance provided by a doctor or other healthcare professional to another doctor or healthcare professional involved in a healthcare act. The term is also used for the consultation provided to those providing emergency care. Specialist telehealth services can include territory telehealth services provided by general practitioners. Teleconsultation can be carried out in the presence of the patient or in a deferred manner. In this activity, direct interaction via video call is prevalent, but it is always necessary to ensure the possibility of sharing at least all clinical data, reports, and images related to the specific case when required. It is an on-demand activity, always scheduled, and cannot be used as a substitute for emergency interventions. Then we have teleassistance or telenursing. It is a professional act within the scope of the relevant healthcare profession, nurse, physiotherapist, speech therapist, and is based on remote interaction between the professional and the patient, caregiver through a video call, to which, if necessary, the sharing of data, reports, or images can be added. The professional providing teleassistance may also use suitable apps to administer questionnaires, share images, or provide video tutorials on specific activities. The purpose of teleassistance is to facilitate the proper execution of care activities, primarily performed at the patient's home. Teleassistance is predominantly scheduled and can be repeated based on specific patient support programs. Another kind of application worth noting is the telerehabilitation. Telerehabilitation can be considered a branch of telehealth. Although this field is relatively new, its use has rapidly grown in developed countries. In general, telerehabilitation reduces costs for both healthcare providers and patients compared to traditional inpatient or in-person rehabilitation. Furthermore, patients living in remote areas where traditional rehabilitation services may not be easily accessible can benefit from this technology. However, certain disadvantages of telerehabilitation, including patient skepticism due to remote interaction with their physicians or rehabilitators, should not be underestimated. So, these are the main applications of telehealth. We will delve into the most important ones. In this course, we will focus on the main advantages of each, the critical issues, and best practices. See you for the next lesson, then.